On the source, WOCA.
I can see for miles and miles and miles and miles and miles.
All right. 24 minutes before 11 o'clock. Nikki Nix is here from Ocala Eye. We're going to talk about our eye care, our eyeglasses, contact lenses. Don't flush them down the toilet. It's a new nuisance that I read about this morning. and I have an article that I shared with Nikki that I saved regarding the blue light that we all are subjecting ourselves to from our phones and our computers and everything, and that it could be a problem, right? So So with that said, good morning.
Good morning. I have briefly heard little bits and pieces of this throughout just discussion amongst employees and staff and patients coming in with questions, and I do know they are. It does have something to do with affecting our vision. I feel like it affects our retina.
That's not a good thing to be affecting.
Yeah, and I don't know specifically if they know exactly at what rate it's affecting us yet. If that makes sense. I don't know. Obviously technology,
new,
right? We weren't as dependent on technology before, and now everybody's kind of got something glued to them.
And also the TVs were 30 feet in front of us. They weren't 30 inches in front of us, right?
Right.
So
well, and I think too, as everything, the size of your cell phone screen is bigger, your computer monitors are bigger, you are getting exposed to
plus
more
when
stuff.
You use these 3D things. I mean, your phone is literally
right to your face.
I mean, 2 inches in front of your face.
Yes.
Yeah.
And I know they have done some things like I set my iPhone to its sleep mode kind of early, but it gets like a weird yellowish amber color on it, and it must be because it's taken some of that blue light out.
Oh, really?
But I know that we do have. I really wish Liz was here today because I know we've talked about it before, but I don't remember. There are filters, like coatings for your glasses that are actually filtering for that, and I want to say it has like a purplish hue to it, almost. That's supposed to help with filtering out that.
Yeah, and so help me understand this, and I hope this doesn't stray too far from the topic. But when you have yellow glasses, does it filter out yellow light, and therefore blue glasses filter out blue light?
No, I think it has to do with the way that the color does filter out certain wavelengths. So it does just keep out certain colors. I don't know which colors match with which colors, though. But I do know that the whole point of it is for it to block.
Okay, and
certain colored wavelengths from coming in.
The other question, because I don't know what you do. So does, when we say blue light, like I'm picturing just light that's colored blue. Is it something different? Is it just called blue light and it's a wavelength?
No, I think it's the blue wavelength, like just the blue blue light wavelength. Yes.
That's crazy because the sky is blue.
I know.
So you would think we're seeing blue light all the time.
I know, but I think we see that type of colored differently. I don't know.
Well, the article is
making
interesting.
Me think too hard too early this morning.
Well, here's my conclusion about the article. My conclusion about the article is that if there is evidence that the light from our devices can cause us to go blind, then the people who manufacture these devices have to figure out a different way to do it, right? I mean, they have to figure out a way so that it's.
Oh, yes. And I can venture to say, since all this stuff is coming out, that they are probably diligently working on stuff already to keep people utilizing their products and not wanting to get rid of it once they kind of get scared once they read things like this. I would venture to say that companies are probably already have their little IT people on it.
Right. And if there's a secret way of doing it and they have like they're the only ones who know how to do it, then Apple, for example, we're going to Apple. They're the ones, I'm not going to get blind looking at Apple. Right.
Sometimes maybe they'll make up screens in the interim to actually put a film.
Then there might be. I mean, I've never even Googled it. I probably will when I leave here just to see, but there may be similar types of things that, you could put as screen savers or screen protectors that it's almost like a filter on your phone until they, get that fixed. I don't really know. I've never looked into it.
Yeah.
No, we went to the Market of Marion and bought these clip-on sunglasses, and then we also bought these amber clip-ons that they say are good for nighttime. Would they be good for that, for the phone, or is that a bad color?
I don't know. I would probably have to see what they're saying would be the actual color that you needed to filter that blue light out.
To read there, yeah.
But I think amber's more so to.
Well, that color looks good on you. Look at
wear those. A lot of people wear those amber glasses like when they're outside. We have a lot of softball players and a lot of golfers that wear them because it makes that white to green contrast very prominent for them.
Oh, okay.
So they can see the ball well. They can, so. We have more patients utilize it for daytime use for those sports activities.
Oh, really?
So,
Okay.
mm-hmm.
I do agree with you. The color is beautiful on Nikki.
Yeah.
Oh, thank you.
I don't know if you want to compliment yourself, but look how nice you're looking. So at the beginning, it strays from the topic, the focal point of the show. And by the way, if you want to bring us back online or in focus, just call Nikki. She's here right now. If you want to call 622-9622, if you have a question about your eyeglasses, your eye care in general, the procedures that they can do over at Ocala Eye are everything. I guess I'm at the bottom end of things with just simply eyeglasses, and the extreme end of things, which is surgery, right? So all everything in between.
Yep.
So here's the thing that strays. There was a story this morning about contact lenses that are flushable, that are disposable. It's another problem, I guess. Like the straws in the environment are a problem. Now they're saying contact lenses are a problem.
The disposable dailies.
Yeah.
I mean, I guess I could probably see it. I don't know how well that material breaks down. Disposables are definitely a lot thinner and, a more pliable material. They're that's what makes them so oxygen permeable and, meaning it's a little safer for the eye because it's made up of, material that oxygen can get through easier so that your eye is getting oxygen.
Right.
I just throw them in the trash. I don't know. I mean, I guess they can still in landfills and stuff end up in the water system for sure. So I don't know.
I guess we're always learning in this world, right? So.
I mean, we don't think about the long-term effect of things like that, obviously,
And you don't think there's when you realize how many people there are that probably throw them away, it probably does make a difference.
I'm sure it probably does. I'm sure it definitely probably does.
But they really are better for your eyes than extended wear because that will be
part of it is just, I mean, obviously they're a little bit more expensive for that reason because you are just taking it out. But when you're putting a fresh pair in every day, you're not allowing it to sit in solution that you've prepared or touched and put in there. And so the odds of it growing any sort of bacteria or fungus, you kind of eliminate all those factors that kind of go hand in hand with contact lens wear, the things that we tell you to, good hygiene and things like that we're preaching for patients for contact lens wearers. There are contact lenses that say that you can wear them overnight and you can sleep in them and, you're supposed to be able to do that, I think, for 2 weeks to a month. But even when we prescribe those types of lenses, we don't, it's obviously at patient's discretion, but we usually recommend they still take them out every night. I mean, it's not good for your eye.
Safe. The safest way to do things.
Is all eye surgery done as an outpatient?
Yes. Nobody stays. Everything that we do now, it just depends. Obviously, there are some procedures that we don't do that are performed at other places that the patient might need to stay overnight for, especially if they've had some sort of trauma and had to have some reconstructive surgery, things like that. It possibly caused them, but everything that we do is an outpatient procedure.
Are your doctors, are they called to the emergency room?
We used to take call at the hospitals, and then it went to we only saw our established patients at the hospitals, and now pretty much we don't take call at the hospitals. A lot of times they're just gonna, have the patient call to schedule an appointment when they get out.
Oh,
really?
If it's something emergent, they'll contact maybe the ophthalmologist on call at Shands, but we don't take call anymore for the hospitals. Now we do call for our patients. I mean, we're on call 24/7 for our established patients that call in, after hours.
Wow. So what kind of emergencies normally happen? Like
for the most part,
lawnmower stuff? That's what I'm picturing.
Well, yeah, a lot of times it's for patients don't really realize. Sometimes I would say the most frequent call I get on call is the days that we do injections for macular degeneration.
Yeah.
Those patients sometimes can have some pain or irritation that evening afterwards because of the betadine that's the iodine that's in the actual injection itself can cause them to be uncomfortable for that first 24 hours.
Oh my gosh.
And I think even though they tell them that prior to the injections, and sometimes they can have several injections and they don't have that reaction, and it might happen with just one. So, even though they've reviewed that with them, I don't think they really think about it happening. And so when it does for them, I think it's a little bit, scary, and they get concerned. And, so a lot of it is just reassurance that it's normal for them to feel that way. They can, take over the counter.
So the emergency room doctors, they have to be well versed.
They do. If I had an eye emergency, I would not go. I would go to Shands.
Oh, really?
The ophthalmology department. I would not. They're just not,
because they have an eye doctor. So.
Right.
Yeah.
They're just not. It's really. I'm sure what little bit they remember from their residency is probably, it's hard for them to keep up with that one. And eyes is probably not something they get exposed to a lot.
And you don't want to waste time. If you've got something going on, I'll never forget that Robin had something with her eye, and they told her, you got to go right now to Shands. And so I said, let's go. We went. Remember, where were we? Was it the emergency room here?
Yeah, it was.
Yeah, I was going to say most of the time too, if it's something emergent or urgent or trauma, they're going to send it to Shands as well. I mean, it's just not within their scope of handling, and they know that the patient's going to get better care.
Thank God there's somebody who can handle it.
Yeah, for sure.
So you're talking about injections for macular degeneration. What are the injections for?
The injections are for patients who have what we call wet macular degeneration. So when it's wet, it means it's actively bleeding. So they've got blood vessels in the back of the eye that are actually bleeding. So the medicine that we inject only targets the bleeding part. So basically it's to stop that actual part from bleeding. Now, once it's bled, it's already caused some damage there, and that part is irreversible, but basically it attacks the leaking blood vessels so that they stop leaking. So therefore it's no longer, wet.
And then you can preserve their sight.
Yeah. So basically it's to keep it from progressing and for them from them losing any more sight. So a lot of times they have to do the injections just as preventative measure, to keep those blood vessels from starting to leak again. So,
and where in the eye do you do the injection?
It's actually injected into the eye itself.
Oh my gosh.
Yeah.
Oh my gosh.
Wow.
Yeah. And most of the medications derived from cancer drugs. So, we've done studies on several different medications. Dr. Sami and Dr. Kraut have been a part of, several different, FDA approved study programs for different medications and things like that. So,
oh my God.
What causes a detached retina? Because every once in a while you hear that detached retina syndrome.
It can be a couple things. A retinal detachment just means that the layer of the retina that is attached to the back of the eye actually comes apart from it. So trauma can cause that. But, if a patient's got patients who have a really long eye, so they have a really what we call myopic prescription, or they're very nearsighted, they have a super long eye. Those patients are at an increased risk for a retinal detachment because their eye is longer, so it has
from back to front. You mean?
Yes. So it has stress on the back part of the eye more so than what a normal size eye would have because it's longer than normal. So those patients are at an increased risk for it. But for the most part, when we see somebody with a retinal detachment, it's just something that's happened. Maybe because of the physiologic,
like an accident or something? Or?
It doesn't, it's kind of like other things. You don't necessarily have to have a precursor for it to just happen. Some people just, unfortunately, happens to. I
think I remember hearing a long time ago that the guys who fly the jets onto aircraft carriers have it happen because they stop so abruptly. It pulls it off. Have you ever heard that before?
I haven't. I can.
So if I'm saying something out of line,
probably a pretty violent stop.
Yeah, they have a hook and
well, I was going to say, you think in a regular airplane how much you feel when you land, the stop, but stopping. Yeah, they're abruptly stopping. That's true. I don't know. My cousin's a F-15 pilot. I'll have to ask him. Yeah,
nice.
I'll have to ask him.
Will you give us a ride? That would be fun.
Oh, I don't know. I don't know.
No, you don't want to ride, Robin. No. I saw Robin on the Aerosmith roller coaster. You don't want to ride. Have you ever gone on the Aerosmith roller coaster?
No.
Oh my gosh.
I don't do roller coasters.
Well, we don't anymore either.
I got off that thing and laid in the grass by the bushes.
God
I
was-
was a tourist attraction.
Wait, God was trying to tell us,
There were
don't do
pictures.
this. You know how I know this?
How?
Because the ride was broken down for 2 hours.
Oh,
And we're
okay.
standing in this stupid line for 2 hours plus the length of the line. So we had 2 hours, just the line wasn't even moving. Okay, it's fixed. Oh, good, Robin. We're going to get to go now. 2 hours later, we're in this thing, and the thing only lasts like 4 minutes. And you hear Steven Tyler go, "Ah!" Steven Tyler singing. and Robin is going, because she's flying upside down.
Yeah, I would be too. I don't. Do
And
roller-
somewhere in Hollywood Studios, whatever that thing is called,
Yeah.
her magnetic name, like you have a thing?
Uh-huh.
See, I have one too, but I don't wear mine because she lost hers. It's
And the
probably
ride.
stuck to the track up there somewhere.
Oh my gosh, you had it on when you got on the ride?
Yeah.
Yeah.
Oh.
Yeah, because we were doing a broadcast from,
Oh, I gotcha.
and they said, okay, now that you're done with it, you can feel free to enjoy the park. Okay, great. One ride. She was so out of it. Let me tell you how out of it she was. We got onto the bus. So let's go. You don't look good. Let's go.
The boat.
We get on the boat to leave. And she stands up and I go, where are you going? I'm just going out to the back of the boat to get some air. I said, okay. And then I look and she's not on the back. She's on the
I'm in the
land.
grass.
And there's like this much space and it's moving. So I did one of those movie scenes.
Oh,
I
so you
laid
got
in the
off
grass.
the boat.
Yeah.
And then
I
she's-
was in the grass.
She doesn't want me to tell you this, but she was vomiting.
happy.
Vomiting.
I couldn't. I'm afraid that I get motion sick so bad, but I'm afraid that that's what
Don't
is
do the
what's
F-15.
Don't go
happened
on
to
that
me.
ride. No, don't go on those.
I just don't even
Never
want to.
But now, here's the last part of the story. Japanese tourists
Oh,
videotaping an American woman vomiting in the grass at Disney World.
yes, you're on YouTube somewhere.
That's right.
You're on YouTube somewhere. You're a YouTube star and you don't even know it.
That was the highlight of their day.
I bet it was. They were like, "Oh, look at this lady." Oh yeah, I can see it.
No.
I can see it. Yeah, I don't do roller coasters, and I can't do those 4D, 3D things either. They make
40
me
3D. What's
like those, like the Harry Potter, those simulated rides, almost like in like the Spider-Man.
Joe can't do that.
I can't do
No.
those either. Like when it gets to the, I can't.
Well, you're
I
not
have
really
to close
moving?
my eyes. Yes.
Yeah.
On the Harry Potter one, you are moving, but there's parts where you're, it feels like you're part of like this Quidditch match. I have to close my eyes because they make me feel.
Oh, I didn't do that
Oh,
one.
because of the
Like,
balls and
It just makes
whatever
me
they
feel
do, yeah.
sick. I don't
Oh
know.
my
I can't.
gosh.
I really wish it wasn't. I would love to try to ride stuff, but
Mhm.
I don't do well.
Do that.
Well, we went up in a plane for the Discovery flight, and Robin
Mhm.
was in the backseat taking pictures, and she got really ill doing that. And it wasn't anything drastic,
Hmm.
but it's that eye coordination or whatever, because she had her eye on the camera, and plus everything was wrong.
It's just anything for me. I mean, even if I'm up on a high story in a hotel and I look out the window, it instantly
Oh, really?
makes
You
me
get
feel that.
What is that called? There's
I
a
don't
word for that,
know.
right?
Vertigo?
Vertigo.
I don't know. I must have. I mean,
Oh,
it's with
my.
everything. I just am not a good. Like I did fine even with our flights to Washington. I didn't, but it's like for 2 or 3 days after, I still feel like I'm
Oh, you do from the
swimmy.
plane?
Like yes,
Oh,
it's
really?
really weird. I don't
Oh my
know. Yeah,
gosh.
Did you go
Oh
for
my
pleasure, or
gosh.
did you have a business
we
trip?
did.
or-
Well, there was a canine conference that.
Nice.
So my
nice.
husband did go to that. I went to
Did the dog
some
go?
of the classes. No, we
No?
didn't have to take the dog.
Mhm.
But the rest of it, we had stayed 3 extra days. So the conference was only 2.5 days. So we stayed 6 and we did some, just personal traveling. I had never been before. So
Do you look at eyes when, of the people around you when you're at different places? Like they'll have, different statues of things and they look human.
mhm.
Do you focus on the eyes to see? if they
I
do a
do
good
look at a lot
job?
of things. It's funny that you say that because a lot of the statues that they had there or, even like when we toured the White House, when they had some of the, heads in there, it always
Uh-huh.
looks like neither one of them are lined up right when they're carved. And I know they're carved out of stuff, but I
Is
do
that
look
right?
at stuff like that. They're not.
Oh, that's pretty interesting.
Yeah. I mean, when I looked at their portraits, their paintings that they had painted, they all pretty much looked, but I always catch
Uh-huh.
myself looking at that people's eye color.
Really?
Yeah,
So-
all the time. It's just,
Is
I don't know.
is that since having this as a career, or did you always do that?
No, since this, I don't know that I paid attention to anyone.
Isn't that funny?
Prior to, yeah.
That's funny.
What kind of makeup do you recommend for people that wear contact lenses?
I think they're fine to wear normal makeup. I think they probably need to more so than the normal adhere to, replacing their mascara every 3 months and their eyeliner the same because of bacteria buildup. Because, obviously if they get little fragments in their eye and it causes some sort of abrasion behind their contact lenses and they have more bacteria buildup because they haven't switched their makeup out, obviously with contact lens wearers, they're going to be a little bit more prone to getting some sort of infection than someone who's not wearing a lens would be. So, we do just recommend to them that they make sure that they, try not to rub their eyes, especially when they've got their contacts in, so they don't create anything like that, but just to make sure that they're replacing it every 3 months, like as recommended, so that they're not, more prone to.
And how about perfume fragrances? I mean, can you tell right away if they start irritating your eyes after you put the scent on? Does that mean you're allergic to it, or?
Not necessarily. I think some people have a more of a sensitivity to some sorts of smells and things like that. Most of the time when people have a reaction to something, it's usually to the preservative that's in it. So like when we have patients who have a reaction to, it's not necessarily to the contact lenses, it's usually to some sort of preservative that's in the contact lens solution.
Oh, I see.
So, a lot of times it's thimerosal is a big one that some of our patients seem to have it's a preservative that's in a lot of stuff actually, and they have a sensitivity to it. I don't know that they're necessarily allergic to it. They're not really having allergic symptoms, but they are sensitive to the actual preservative. So sometimes they just have to, change what it is, or they may have to be patients who go to a daily lens where they're not, it's not sitting in a solution and things like that. So.
We talked about once before supplements, vitamins, etc., that are good for your eyes. Is there, at the risk of violating a little radio rule here, is there a brand that you would recommend? Is there one that you like? If I go to the doctor and say, "Is there anything I could take?" Does he think it'll help? And B, if he does, is there a brand that they recommend?
Well, it just really depends, because obviously if you're healthy otherwise, and let's just say you don't have any dryness going on or anything like that, they do make specific vitamins that are geared more towards dryness, because it's a systemic thing more so than it is just, a component of your eyes. But, multivitamins are, I think, always good for everyone to take, just because you're going to, if you're not getting enough from your diet, if you're not eating enough of your things, then everybody can use an extra little bit of vitamin K and, vitamin D and things like that. But, obviously our patients who have macular degeneration, we actually recommend that they take specific vitamins for that. And if they smoke, then there's a brand that they can't take because of the beta carotene that's in it. So there are things like that we go through, but it just isn't a general rule of thumb. I don't know of any that they just, especially if someone's not really having a problem,
I think the one word that is on labels is lutein. Is that right? Salt to the L. Is that what they say? And that's supposed to be good for your eyes?
Yes. So that's definitely what we recommend, especially for patients who are in the macular degeneration family. So those eye vitamins do have lutein in them, and lutein is something that helps with slowing down the progression of it. They really haven't found anything that cures it or stops it or anything like that, and they are working diligently on it because it is such a prominent eye disease for patients. But it definitely helps the progression of it.
And how about those masks? And then you see these women with like cucumbers on their eyes and things. Is that a good idea to do something like that?
It doesn't hurt at all. We sell a couple of different masks at the office. We have one that's called a brooder mask. That's kind of like those little beaded heat pads that you use for everywhere else. You stick it in the microwave for like 30 seconds and put it on your eyelids. People with dry eyes tend to use that one because that warm, moist heat helps kind of open up all those glands where your eyelashes are and kind of clears them out some. We also have a fire and ice mask that you can heat up or cool off. So, it's just comfortable for patients too. Sometimes when they have bad sinus problems, they're all a lot of them are located right around your eyes. So it can cause them discomfort as well. So.
Wow. Man,
so much information.
Really
wow.
Stuff.
I like imagining you at the wax museum looking at the eye.
I do.
Don't look at any Picassos because those eyes are really, I don't know what he was thinking. Nikki, thank you for doing this.
Thank you.
How do we get a hold of Ocala Eye? What do we do?
They can call us at 352-622-5183. They can visit us on the web at ocalaeye.com or visit us at our Facebook page.
And if you need an endorsement, I am a customer of Ocala Eye. And
Yes,
a satisfied customer. I think of you guys every time I put my glasses on.
Good.
Thank you. Thank you, Nikki.
You.
We'll be right back.
Santa, baby. It's rodeo time in Ocala. August 31st, September the 1st, 7:30 nightly. The superstars of professional rodeo return to the Southeastern Livestock Pavilion. The 36th annual Ocala Shrine Pro Rodeo brings you the best of man, muscle, and a stampede of horsepower. For tickets and information, call 352-402-8808 or check us out at OcalaShrineRodeo.com. Ocala, get ready to